How does global research refine testicular cancer surveillance? Imagine a world where doctors can catch cancer coming back early, but also avoid unnecessary treatments that can cause long-term harm. That's exactly what ongoing research helps achieve in testicular cancer surveillance. After initial treatment, usually an orchiectomy, patients need careful monitoring to spot any signs of recurrence. But how do we know the best way to do that? That's where global research steps in, constantly updating and improving guidelines based on the latest evidence. International expert groups like the National Comprehensive Cancer Network and the American Urological Association analyze data from clinical trials and patient outcomes across many countries. They develop standardized protocols that recommend how often patients should have physical exams, blood tests, and imaging scans. For example, in the first year after treatment, patients might have checkups every 3 to 6 months, with less frequent visits over the next decade. These guidelines are regularly revised to include new findings, making surveillance more effective and less burdensome. Research also helps doctors personalize follow-up care based on each patient's risk factors. For instance, patients with low-risk stage 1 seminoma might only need surveillance without additional treatment. Factors like tumor size, histology, and serum tumor markers such as human chorionic gonadotropin and alpha-fetoprotein help determine how often and what kind of tests are needed. This risk stratification ensures that high-risk patients get closer monitoring, while low-risk patients avoid unnecessary procedures. Advances in imaging technology and blood tests are key parts of this refinement process. While magnetic resonance imaging is not typically used initially, it can be helpful in specific cases. Blood tests for tumor markers are essential for surveillance, and research continues to optimize their timing and interpretation to catch recurrences early. The goal is to detect relapse when it is still treatable, without exposing patients to excessive radiation or costs. Another important aspect is balancing the benefits of surveillance with its potential harms. Overly aggressive follow-up can lead to unnecessary anxiety, fertility issues, or exposure to radiation. Research emphasizes that early detection should be achieved without overburdening patients or causing avoidable side effects. This approach helps preserve quality of life and long-term health. Long-term studies across the globe provide valuable insights into when relapses are most likely to happen. Evidence suggests that most recurrences occur within the first few years, but some can happen even after 10 years. That's why current guidelines recommend follow-up for up to 10 years, ensuring that late recurrences are not missed. In essence, global research is shaping a smarter, more personalized way to monitor testicular cancer survivors. By integrating new evidence into guidelines, healthcare providers can better balance early detection with minimizing treatment-related harms. This ongoing effort supports not only effective cancer control but also the overall well-being and future health of patients. Remember, always consult healthcare professionals for personalized advice, as individual needs can vary widely.